I'm Jane Ellis. I'm one of the maternal fetal medicine specialists at Grady. I'm an Emory doc. I'm medical director of our regional perinatal center here at Grady. Probably since 2007. I first met Dr. Klein when I was a third-year medical student, rotating through labor and delivery, and I was doing my week on the antepartum service, our pregnant patients who were in the hospital, and Dr. Klein was the attending for the week that I was there. And she rounded with us every morning, took report on the patients, so I first met her that way. She was actually pretty influential in my decision to go into maternal fetal medicine. I was very impressed with her when I was a student and as a resident. And I had always heard that she was sort of this, had been around forever woman who was, knew everything, and people seemed to be afraid of her. But as I got to interact with her as a student and then even as a resident, I realized that that was not true. She was not a person who would intimidate you or, not be helpful or nice to you. Her maiden name is Bear, and there are a lot of people that refer to her as Teddy Bear. So she really is sort of like a teddy bear. And she sort of helped me make the decision to go into maternal fetal medicine and women's health. And throughout my career as a resident and as a fellow here, I touched base with her often just to let her know what I was doing, what I was interested in, and let her sort of offer her words of wisdom as to what I needed to do next. And I've worked with her since I became an attending after I finished my fellowship. Intern in 1996, so intermittent contact through the time I came back. I did my fellowship 2002 through 2005 and then became an attending at that point. So pretty much daily contact with her throughout my fellowship and my time as an attending here. I found her to be just a remarkable individual. She's very warm. She wants to teach. She wants people to learn from her. She wants to teach you to give to women. She's very much an advocate for women and women's health in whatever role or whatever capacity. She was able to serve women. She was a big advocate for doing everything we can to help women of all socioeconomic backgrounds and all needs. So throughout my fellowship and time as an attending, I worked with her primarily on issues such as maternal mortality in Georgia. She was really an advocate for getting a maternal mortality review committee set up in Georgia, which was here for a while and then fell by the wayside and now has just been started again, thanks to Dr. Lindsay. And I worked with her on what we call our Mother and Infant Grant here at Grady. It's a grant from the state and federal government to provide health care for indigent women and their babies. She wrote the grant. She and Al Brand, I should know the date, probably back in the 50s or 60s, and that grant has continued. So I was interested in assuming that role when she decided it was time for her to leave. So I'm now the director of that grant also. And it's been a remarkable experience because of what she's set in place, just to know that we have this funding available to Grady to help with our indigent patients. I can. One thing I learned from Dr. Klein and what she has told me over the years is never let anybody tell you no. If you want to do it, just do it. So probably one of her favorite stories to tell about herself is when she first came to Emory. I believe she was married to Roger Klein, who had an administrative position in the hospital at Emory. And when she first came down with him, I think she wanted to come to work for the department and was told no, that they would never hire a woman in this department. So she went back, I believe, to New York for a while and then came down for a second attempt at getting a position in the department. Dan Thompson hired her as a faculty member, and then she went on to become the first female chair of a department at Emory, and she was also the first female president of ACOG. Probably her favorite story to tell about herself is her first meeting, chairs meeting at Emory, where she was the first woman chair, female chair of a department. She was sitting next to a gentleman who was finishing his cup of coffee, and she said he slid his cup over, and said, "I take mine black." And she said, "I slid that cup right back and said, 'You'll have to go get it yourself.'" And she said, "I leaned back and just watched the jaws drop." She said there was no way that I was getting up and getting his cup of coffee unless I gave him my cup to fill my cup also. She said, "I'm on equal standing, and that's the way it should have been." So that's probably one of her favorite stories to tell about herself. Her legacy as a teacher is she always encourages us to know more. Even if you think you know everything you need to know about a patient, a medical condition, whatever, she tells you you need to go read more. You need to know everything you can to take care of patients well. So her legacy as a physician, I think, was to make us as physicians aware of what we needed to best take care of our patients. And in her realm, it was primarily, of course, female patients. She was a big advocate for women's health, for women's access to health care, and for women to have all the opportunities they need in terms of making their health care decisions. She many times said, I always got in trouble on my position for rights to terminate pregnancies and so forth. She felt that was definitely a woman's decision to make with her physician. And she said, we as physicians need to advocate for our patients because we know better than anybody except the patient what they need and what we can do to help them get that. And then just as a teacher and as a physician together, again, just knowing everything you can know, doing the best you can to take care of a patient, advocating for that patient, helping that patient negotiate the health care maze so that our patients get the care that they need. And again, she was particularly interested in pregnant women and their babies, so her legacy as an obstetrician and a maternal fetal medicine specialist, I think, will live for many years to come. Really not right offhand. I know she said when she came to interview here at Emory, she was initially told, we'll never hire a female member in this department. And then, she said, one of her proudest accomplishments, she said, was to be able to come back and be hired here by Dan Thompson and then to go on and be chair of the department. I think she would have liked to have called the person who told her we'll never hire a female here in this department, just to let him know that she was now not only a faculty member, but the chair. It truly is, and I think that's a change that she is proud to see. I mean, she has no problem with male residents and men being involved in the profession because, they have things to offer too. But I think when she was starting out, there were so few women. I think she did a residency in medicine and a residency in surgery, so she was not used to seeing other women. So I think that's one of the changes she's most in favor of in OBGYN is that we now have so many females actively involved in the field of women's health. My mother, for example, really had a male OBGYN all her life, and that's the way it was. My dad did not think women belonged in the field of medicine. And when I was, considering going to medical school, he said, well, just go be a nurse. And my mother said, nope, let's go be a doctor. So I always have her to thank for that, but he was taken care of by a female family practice doc the last 5 or 6 years of his life. And I did, talked about him at his funeral. And when I said that, I said she was in the congregation, and I mentioned that my dad really didn't feel that women needed to be doctors. They had other things they needed to do. She came up to me and said, "I'm so glad I didn't know that, because I would have told your dad exactly what I thought about that." I said, "Good. You had a very good working relationship. He loved her, so it worked out for the best, I guess." As a trailblazer, and she's been involved in WHO, Family Health Initiative, really especially as an advocate for family planning and birth control in third world developing countries where those types of services often aren't available but are certainly needed. She was a big advocate for getting those types of services where they were needed to be, and I think she's gotten a tremendous amount of international acclaim for her role in pushing to get women what they need in those situations. I've seen her, she was, I think, responsible for helping me get on a committee at ACOG for underserved women. One of the sort of subcommittees of that group, the Alaska Native and American Indian committee. It's a great committee. It's small. We do a lot of traveling to site visits and so forth for some very remote areas in this country. And while we were, and Dr. Klein was involved in that committee too for a number of years. So at one of the committee meetings they were having the first International Indigenous Women's meeting, where there were women from all over the world, from New Zealand, from some of the Australian tribes, the Arctic Circle, at this meeting. And it was a fairly large crowd, and she walked into the room, and immediately people stood up and applauded. And I was sitting next to her. She said, "What do you think that's for?" And I said, "Because it's you." And she was amazed at the end of the meeting with so many people coming up to introduce themselves to her and say, "You don't know me, but you helped inspire me to go into OB, to be an advocate for women's health care." She seemed completely taken aback that people recognized and appreciated her role in women's health so much, not just locally or nationally, but in the international community also. It was wonderful, and she was just so, "What are these people coming up to me for?" I said, "Dr. Klein, it's you." So she was just really amazed and just totally unaware that people had that much knowledge of her and respect for her. And it was, to me, quite an experience to see her so surprised by it, because I'm like, you've done everything, everybody knows Dr. Klein, but she didn't see it that way. She said, "I'm just a doc doing my job," so that's the way she was. No, just that I'm so glad that she's getting the recognition she deserves. She came through, a period in time when women weren't where we are today, and she persevered. She did what she wanted to do. She had her goals set. She knew what she wanted to do, and most importantly, like the advice she gives me, never let anybody tell you no. She got lots of no's in her life, but she just never really let anybody tell her no. So that's how she got to where she is today.